Bismillahirrahmanirrahim. I am Taimur Hassan, working as a lecturer at the Department of Health Professional Technology and under the umbrella of Faculty of Allied Health Sciences, the University of Lahore. I am currently pursuing my master's in pharmacology and toxicology from Changzhou University, Jiangsu, China. So today I'm going to present a topic which is health-related issues in South Asia. More specifically, we're talking about Pakistan, India, and the Bangladesh. And in this particular lecture, we will discuss about the health issues which are being faced by these three nominated countries in that comes under the South Asian region of continents. So in this lecture, we will discuss about we have some learning objectives. And in this lecture, the students, they will learn about what is a health system and what is a healthcare system. Then we will talk about the health related system, or you can say issues in Pakistan, India, Bangladesh. And then we will discuss about the challenges and the impediments each by each. And then we will talk about their way forwards. So we will first start with a very basic definition of health. What is a health? So according to a definition which was being given by the World Health Organization in 1948, it states that a health is a complete state of physical, mental, social well-being, and it's not just merely the absence of any disease or any kind of physical infirmity, right? So then we will talk about what is a term issues, what is the term issues means. And while defining the term issues, we can say that the defects or the flaws or the concerns that needs to be strictly addressed are considered to be as the issues. So then we will talk about what is a term health issues mean. The problems, defects, deformities, and the flaws that are present in the health sector of any nation and that needs an urgent attention by the policy makers, more specifically the government, or you can say the stakeholders, is defined as the health issues. And this definition was being derived by the Bloomberg. So here we will talk about the health conditions in Pakistan, in 2014 or 2015 from the Pakistan's economic survey. It was mentioned that approximately out of 3.945 trillion, only 102.3 billion have been, you can say, invested on the health related issues in Pakistan, right? So here we have a pictorial representation of the health facilities in Pakistan. Here you could see that 76 million people, they do have the lack of access of sanitation, and 54 million Pakistanis out of a population of 165, which now been you can say promoted to 2 million population. They don't have an access to a safe drinking water. And approximately 7 to 9 million people, they have become, or you can say they are victimized of a malnutrition. So as far as the health is concerned, we could see that approximately only 5% of the Pakistani population, they are considered to be a healthy people. And Pakistan and the total spending of Pakistan in its budget, in its totality of the budget, it states that only 2% of the Pakistan's GDP spends on health. For example, if you could see there, for example, if hypothetically, if a country have a budget of 100 and out of that only 2 rupees or only 2% is just being invested on the health issues, then we could see that approximately 40% of the women you can say pregnant women in Pakistan, they are anemic, and 10% of our adults are quite overweight or obese, and approximately 35% of the children under 5 years, they are just short of their age just because of the malnutrition, and approximately 10% are underweight from their heights. So here I have mentioned about a demonstration which were being, you can say, extracted from the past newspapers from Pakistan. One is the Dawn and second one is from the news. According to Dawn, it's mentioned that approximately 5 lakh the cases of tuberculosis are being reported in Pakistan each year. And we could see that the government, they have launched about the prevention of the non-communicable diseases plans. So here we will talk about the health issues in Pakistan in sequence wise. So the major issues to health in Pakistan, you can say specifically demonstrates about the infrastructure and the resource development. And then we have a dire, you can say, issue of health in the management of health sector. Then we have a dire issue in research and the development in our health sector. Then we have the communicable diseases, and then we have the non-communicable diseases. These are actually 5 major issues which are actually being faced by the health sector of Pakistan. So then we will talk about health infrastructure and the resource development in Pakistan. As you could see that the provision of a good health services totally depends upon the condition and the availability of a basic health infrastructure in any country. And there are many possible indicators of health infrastructure. For example, the number of hospitals, the number of health units, the number of dispensaries, the number of beds in the hospital, equipments, and the other diagnostic facilities. For example, either the radiological facilities or either the laboratory facilities. There is, and it's been precedented that there is no major establishment in the public health sector in Pakistan since 1985. And as we could see that our populations has been tripled from that, you can say, exact figure. So we need to improve our infrastructure to treat different emerging and the re-emerging infection or the disease. For example, as you could see our health setup in the advent of novel coronavirus. So what is the way forward that we could have to just to, you can say, sustain or just to cope up with the infrastructure instabilities in Pakistan, for example, in its health structure? There must be an improvement in health resource development programs. There is a need to give advanced training to augment to the skill development and the personnel in the health sector. The advanced nursing programs in introduction to the technologies in the health sector and the special trainings to the young doctors is the need of time that meets with the emerging health crisis in Pakistan, right? So then we have the management issues in our health sector. As we could see that a good management provides a very basis for the effective, productive health services for which professionally qualified public health specialists are needed. They plan, organize, administer, and evaluate the community health programs. But now we could see that now the public health institutions are providing proper training to the manager, or you can say the health personnel. Also, there is a need to strengthen the health institution in all the provinces of Pakistan, including the Punjab, the Sindh, Khyber Pakhtunkhwa, Balochistan, FATA regions, and Gilgit-Baltistan as well, to make the postgraduate qualifications accessible to every medical graduate in Pakistan. So then we have the research in our health sector. There is a lack of interest and orientation in the field of research, in the field of medical research. Research in the health sector can provide important information about the disease trends, risk factors, outcomes of treatment or the public health interventions, and you can say and the healthcare cost. But the clinical trials provides information about efficacy and adverse effects of medical interventions by controlling the different factors that can affect the results of any study. So it also plays a very pivotal role to record and assess the experience in clinical practice in order to develop the guidelines for the best practices and to ensure the high quality patient care. And to be continued, the development of new therapies and remarkable improvement in our health care and the public health is based on research, more specifically in medical research in our health sector. The research in health sector is has imposed a great challenges for the scholars. We don't have a proper medical research funding. We don't have a proper medical labs. We don't have a proper experimental equipment. So these are the, you can say, problems that a medical researcher is actually being facing. Although there is a research is an important component for a postgraduate student, but the quality of teaching of students in writing medical research is still a grave challenge for us. Then we will talk about the communicable diseases, which is a dire health concern for Pakistan. So let's talk about them. Communicable disease, it's kind of a disease that can be easily transferred from one person to another person, and the communicable diseases, they puts up a very high ratio in mortality in Pakistan. The major cause for the rapid spread of disease includes overcrowdedness, or you can say hyperpopulation, low health awareness, unsafe drinking water, water, inadequate sanitation, and the poor socio-economic conditions of people of Pakistan. So here we have some diseases of a non-communicable diseases. So we will talk about them one by one. One do we have the acute respiratory infection. It interferes with the normal breathing, and it specifically affects our upper and the lower respiratory systems. The symptoms may include may include some fever, runny nose, cough, and difficult breathing, sore throat, fatigue, pharyngitis, bronchitis, and congestion in the nasal sinuses or in lungs. The children with low immune systems are more prone or vulnerable or susceptible to acute respiratory infections. Then we have a viral hepatitis. Viral hepatitis includes either A, B, or C. It's a collective group of the distinct diseases that actually affects our liver. Each type of hepatitis have different signs and symptoms, and the symptoms, they vary from flu, fatigue, you can say abdominal pain, dark urine, joint pain, nausea, vomiting, jaundice, and a clay-colored poop, or you can say stool. The main cause for hepatitis B and C is due to the blood transfusions. As you could see that we have a lots of blood transfusion systems in Pakistan. We do have a dire crisis. We do have a thalassemia patients, and due to the inadequate facilities, we actually transfuse blood, or you can injections to the people without any proper aseptic techniques. Then we have spoiled, you can say equipment, for example, razors, toothbrushes, and other household thresholds. And then we have the malaria. It's a life-threatening disease which is being caused by a parasite. The majority of people living in the slum areas, more specifically, suffering from the disease. And as you could see that approximately 70% of our Pakistan population still lives in rural areas, and most of them, they live in a slum. So that could be, you can say, epitome, or that could be, you can say, like a primary factor that causes a malaria. This disease is being caused when a mosquito breeds on unclean, stagnant, or unsanitary water. The conditions which is common in rural areas, the symptoms, like it could be a fever, a headache, or the chills. Malaria can also cause death if it's being not treated, or if it may, you can say, proceed at any, you can say, a severe stage. And if it left untreated, the use of nets and the mosquito repellents are quite common practice to you can say, just to execute, or you can say just to like keep the mosquitoes away from us. So then we have the HIV or AIDS. It's a human immunodeficiency virus. It's been spread through sexual transmission and can be spread by the infected blood from the mother to child during the pregnancy period. It can be observed that there are around 1 lakh HIV positive cases in Pakistan. And if you could see in 2015 and 2017, we could see the outbreak of HIV in rural Sindh in Pakistan, and that was quite alarming situation for us to deal that. And there are some malpractices of certain quacks or practitioners that are also playing an equal part for the spread of HIV. So the major cause for this disease in Pakistan is the use of infected syringes. As I've already told you, the symptoms include from mild fever, headache, joint pain, sore throat, swollen lymph nodes. The government needs to take serious action to prevent the HIV/AIDS, because this disease is still not curable, but at least we get a very basic, you can say, a medication just to treat the HIV. And then we have the tuberculosis. The tuberculosis, it's a serious infectious disease that typically affects our lungs. The Pakistan ranks the top in it, like the Pakistan ranks top in 5 countries that still there who are quite susceptible to TB, according to the reports which are being advertised by the World Health Organization. Still, the symptoms and the signs you consider the fever, fatigue, chest pain, swelling, chills. Then the loss of appetite, sudden weight loss, and cough with the blood. The transmission of a disease is more done by sneezing and by coughing, and it may become deadly, and if it's not treated on time. So here we do have some non-communicable diseases that's also a dire concern for the health sector of Pakistan. As we could see that approximately 41 million people from Pakistan, they die, from around the globe, they die from the non-communicable disease every year. And the NCDs, or the non-communicable diseases, more specifically include the cardiovascular problems, the diabetes, cancer, and coronary heart diseases. So there is also a point to ponder that I really want to mention, is that NCD is also known as a chronic disease, and it's kind of a disease that actually advent for a very long duration and are the combination of some genetic, physiological, and environmental factors. And we do have some other risk factors for the non-communicable diseases spread, for example, in old age, rapid urbanization. Then we do have the globalization, unhealthy food, unhygienic or unhealthy activities, and the lack of physical activities. So then we will talk about what are the way forwards that we can meet to sustain the health structure of Pakistan. We can resolve the health issues by improving our biomedical research. We can improve our biomedical care, improving the strategic plan for the public health and information technologies, biotechnologies, by making the good, by implementing or by providing the good policies and planning and development in research services and regulation of pure pure food and medicines. So then we will talk about the health conditions in India. India's health condition is quite identical to Pakistan. They do have more hyperpopulation they have from Pakistan. Their population, you can say, has increased about 1.5 billion people. So it's kind of a huge mass of people. So they do also share the common communicable diseases, non-communicable diseases, environmental sanitation problem. It's quite common in India. Medical care problems, hyperpopulation or overpopulation in India, and other nutritional problems are quite advent in India. So here we could see that in the past, some of the news, they reported that the Indian cholera, like in the past 1970s, an outbreak of cholera, it was being spread in India, and approximately 15 to 20 million people, they are being victimized of this Indian cholera. So that's a grave concern for that actually caused, that was a quite alarming situation for the people of India. So they do have, so we and in Pakistan, India, they share a common disease as malaria, tuberculosis. The incidence of malaria causes fluctuated between 1.3 to 1.6 million per year in India. The tuberculosis, like it adds approximately 1.2 million people cases on annual basis, and approximately 0.64 million cases are of new smear positive, and out of which approximately 0.32 million people dies of tuberculosis each year in India. So then we have the diarrheal diseases, the second most common cause of death in Indian population. The diarrheal disease is responsible for 1 in every 10 child deaths during the first 5 years of life worldwide, and has the highest rate of incidence. As you could see, the diarrheal, you can say, crisis in Africa as well. The acute respiratory infection in India, approximately over 4 lakh people, they die each year just because of the pneumonia, and accounting for 13 to 16% of all death in a pediatric hospital admissions. Then we will talk about the leprosy, which is, you can say, a grave concern for India. India ranks first in the new cases of leprosy according to the World Health Report, which was publicized in 2012. That accounted approximately 134,752 cases of new leprosy, and India ranks 1 in leprosy. And approximately about 12 million people, they are being diagnosed or they are being living with the leprosy in India since 1991 to 2007. And then we have the filariasis, endemic in 25 districts across 20 states and the Union Territories of India. About 614 million people in India are being infected with the filariasis. And then we do have AIDS. India has the 3rd largest number of people living with the HIV in the worldwide, with 2.1 million infected people. The amounts to about 4 out of 10 people are infected with the deadly virus in Asia Pacific region. China, India, Indonesia, Myanmar, and Thailand or Vietnam, these are quite victims of the AIDS. So here we could see that the South Africa, it ranks number 1 in HIV cases. Then we have the Mozambique, it ranks 2nd in the HIV cases, and then India, it ranks number 3rd for HIV cases. And then we will talk about a non-communicable diseases in India that accounts for approximately 53% of all deaths and 44% in daily life. We have diabetes, cancer, blindness, and cardiovascular diseases. Then we have about the environmental sanitation problems. Approximately 400 million people defecate in open environment and 44 mothers dispose their children's feces in open environment. India accounts for 60% of the global and 50% of its own population in open defecation. Then India, it faces the medical care problem. India has a health policy, not a health service. The need-based service have primarily centered to the urban population, which houses approximately 32% of the national population. The doctor population ratio in India stands from 1 into 1700. That's less than a ratio which is being prescribed by WHO. That's approximately 1 into 1000. So the overpopulation is also, you can say, a dire concern for India. And the nutritional deficiencies in India, it also plays a very important role for their health crisis. So then we will talk about major issues which are being faced in Bangladesh. For example, they do have they share the health infrastructure and the resource development with Pakistan, the management in the health sector, population explosion, poverty, sanitation, communicable and non-communicable diseases. So what are the way forward? We have already talked, or you can say spoke about the way forward. We have to improve our biomedical research. We have to improve our healthcare. We have to improve our healthcare facilities. We have to increase our hospitals. We have to, you can say, establish our basic health units. So at least like people from rural areas, they can get a very basic, you can say, aid for the health crisis. So we could see that from the number, the health status of Bangladesh, there are an estimated 3.05 physicians per 10,000 population and 1.07 nurses per 10,000 population in Bangladesh, according to the World Report, which was publicized by the WHO, and it's a quite major concern. So they do share the communicable diseases, for example, tuberculosis, HIV, tetanus, malaria, measles, rubella, and leprosy. And they do share the common non-communicable diseases, the diabetes, the cardiovascular diseases, hypertension, stroke, chronic respiratory diseases, and ultimately the cancers. So what are the health concerns according to World Health Organization? The health concerns specifies or mentions about elevating the health in a climate debate, delivering the health in conflict and the crisis condition, making the healthcare fairer to everybody. And there is a slogan of WHO that says that health for all. But we could see that the World Health Organization is repeatedly getting failed to provide the health assistance to all of the people. And as you could see this precedent in COVID-19 pandemic, we could see that only the developed countries, they had the access towards the vaccines, but the developing or the underdeveloped countries, they didn't have a proper access to the COVID-19 vaccines. So that actually specifies the standards of the WHO. I have shared a reading in my lecture. Say we could, here the students, they can go and they can find a very detailed note of a WHO for the National Health Vision of Pakistan. And here is some assignment of a case study. What do you know about COVID-19? What are its signs, symptoms, tests and treatments, and its impact on human behavior? And here are some references from where I have extracted this particular topic. You could get the World Health Organization report. Then you could see different journals in which these health concerns are specifically mentioned. If you have any questions, you are free to ask me. Thank you so much.